Hello and a very warm welcome. Thanks for tuning in to another one of our very special TV9 webinars, which is, of course, superbly collaborated and powered by USV, your reliable healthcare partner. And what we're essentially trying to do is collectively get together, beat diabetes and win life, which is why the umbrella theme of Samajdar Bano, Sehat ke Ishaare, Samjho. This World Diabetes Day, we're bringing you stories, insights and inspiration from the real people. I call them super docs who are helping India beat diabetes and win life. It's, let's say, early morning. Coffee is brewing on the sidelines, traffic is rising, emails are pinging before breakfast is even done. And for millions, there is an extra layer to this entire rush. Quietly checking a glucometer, making a mental note of lunch carbs or slipping a small medicine strip into your work bag. And this is daily reality for those that are managing diabetes whilst balancing careers, their families, and life's endless demands. And today, we talk about diabetes not just as a condition, but as an ongoing journey, a way of life, of self-care, of alertness, and everyday victories. Because at the end of the day, let's not forget, one has to be Samajdar and understand the science of bodily health. Hence the umbrella theme, like I mentioned before, the Samajdar Bano, Sehat ke Ishaare, Samjho. Now, just a quick statistics, worldwide, over 537 million adults are living with diabetes. And a huge number of them are in their prime working years, just like you and I. For working adults, diabetes can mean more sick days, higher stress, and even early retirement. Studies show people with diabetes may miss 2 to 7 more work days each year compared to others. You might think that's not a lot, but adding up to billions in lost productivity and rising health costs. But statistics tell only half the story, because there's the emotional toll too. Stress, anxiety, depression. It affects nearly 40% of people living with diabetes. And add to that stigma or lack of workplace support, and managing diabetes can feel like fighting more than 2 battles, one inside the body and one outside it. Yet the story doesn't really end here. Across India, focusing on our own country and of course the world, research and real-world experience show one clear truth, that with awareness, with support and a few small lifestyle changes, diabetes can be managed and managed quite effectively. Flexible work schedules, wellness programs and open conversations at the workplace can help employees stay healthier and happier, and help companies build stronger, more empathetic teams. And to decode exactly how India can beat diabetes and win life, we're joined by an esteemed panel of experts, and I call them super doctors. Let me quickly introduce them to you. Dr. Anjana, RM, Managing Director and Consultant, Director of Dr. Mohan's Diabetes Specialties Center in Chennai. Many thanks for taking out the time, Dr. Anjana. She's been doing some superb work. We'll get to that as well. Dr. Hemant P. Thakur, Consulting Physician and Cardiometabolic Specialist, Jaslok, Breach Candy and Reliance HN Hospitals in Mumbai. He's a big man. Too many feathers in his hat as well. And Dr. Jasjeet Singh, the man with the beautiful suit that you can see, Director, Endocrinology and Diabetes, Medanta Gurugram. You know, many thanks, doctors, for taking out the time. Let me quickly get the snowball rolling here. Let's start easy for those who really don't understand. Dr. Anjana, what really is diabetes? Is it you consuming more sugar? Is it the fact that your body can't fight breaking down a lot of sugar? What really happens? Because in India, diabetes means meetha mat khao.
Thank you, Kabir, for that. Diabetes simply means high blood glucose. That's it. Glucose is a primary fuel for the human body. Everybody needs glucose. Glucose is generally broken down by the hormone called as insulin, which is secreted in your pancreas. Now, if you don't have enough insulin in the body, then you don't have enough hormone to break down glucose. So that can give you diabetes. Or you can have enough insulin, but it's not working very well. Or you could have body fat that is interfering with the working of insulin. So any of these conditions can raise your blood glucose. It can be the meetha mat khao is a separate story completely. That's probably carb cum cow is probably better said for that.
Oh, carb. I mean, don't consume a lot of carbs. That's what you're saying.
Less
So
carbs.
all those out there with the sweet tooth, there's seems to be some good news on that particular front. It's not about how much sweet you take. I think carbs is what needs to be looked at. But holistically, let's not trivialize this matter, Dr. Anjana. Can you break down, a balanced plate? What would that look like for somebody, let's say in their 20s to 30s, between that age gap? Because these days you've got so much of fast food. We use our mobile phones almost for pretty much anything. Fast food, it'll come to you in 15 minutes, in 20 minutes, depending on that time. So what should a plate really look like?
So your thali, let's just put it simplistically, divide it into half first. One half of it, 50%, fill with green leafy vegetables. Okay, fruits and vegetables are fine in a non-diabetic person, but remember, fruit doesn't mean banana and vegetable doesn't mean potato, because that's what 90% of Indians consume. So green leafy vegetables, the healthy stuff, put it in half your plate. The other half divide into two quarters. So one quarter is for your carb. Okay, so that in whatever you like, rice, wheat, doesn't matter, right? And in the other quarter, you make it full of protein. So you pick animal protein if you like, you pick plant protein, doesn't matter, fill it with protein. So that's the overall water's on the side, dairy's on the side. So all of this together is what a healthy plate looks like.
All right. Many thanks for that, Doctor. Dr. Hemant, I'm sure you come across so many people that are balancing their professional careers whilst tackling and struggling with diabetes. Give us a sense, help the viewers understand what are some of the challenges that a diabetic person would face, let's say, in their workplace.
So this man who's been diabetic for more than 5 years, when he comes to office, if he is well controlled, there's no problem. But you know that only 20 or 25% of the patients reach their target sugars. So this man may have had a bad night, getting up often at night to pass urine, which is one of the signs of diabetes. Because of his high sugars, his muscles are fatigued. Every nook and corner of his body has been inundated with high sugars. So he cannot optimize his physical performance in the sense going from table to table, or if he has to walk in the office, or if he's a salesman to stand long, whatever the physical requirements are less. In addition, because of muscle and nerve fatigue, and if he's been diabetic for long, his vision and his nerves are also weak. So the finer tasks that are required of him may also be compromised. So these are all high blood sugars. But the other person, lesser in number as we see in office, if he is endeavoring to control his sugar very accurately, and if he's taken some oral anti-diabetic agent or even insulin and not had his proper quota of meals, or because the train broke down, walked 2 train stations, his sugar drops. And these people can have sweating, fainting attacks, etc. So what I liked in the beginning is awareness. Share your problems. A handicapped person puts on his car, I am handicapped. A man who has an improper lower limb in one side because of a genetic or childhood deformity says, I need a wheelchair, handle with care, carries a cane. So you need to let your colleagues and the people around you know that you are diabetic. So they are sympathetic. They give you the kind of tasks that you can do and that don't give you that you cannot do. And with that, the person is able to complete his chores in the office. Diabetes is a way of life. One in out of every 4 Indians is diabetic.
Yep.
You've got to teach him to live with the affliction. I don't want to call it disease, I want to call it affliction, because with programs like yours and physicians and caregivers, people will learn to live with it happily, with controlled sugars, eating the thali that Dr. Anjana just served us. And of course, if they listen to the program, my other colleagues will also enlighten them.
Well, Dr. Hemant, with a very poetic brush, you've painted quite the grim picture, but added a layer of sweetness to all of this as well. Good thing that we're talking about diabetes over here. At my own home, my mother suffers from diabetes. I don't know if I should be bringing in this personal story, but, we constantly have this debate at home that if diabetes had a personality, would it be more like a silent stalker, or would it be one of my nagging aunties, who just wouldn't go away? And we constantly talk about that. Just to get a little bit of a funny bone system going here. Dr. Jasjeet, Dr. Hemant and Dr. Anjana, they've told us about what a plate should look like, what are some of the challenges a diabetic person would, face in a workplace. Awareness and communication seem to be key pillars in fighting this diabetes and embracing the fact that this is a way of life. According to you, what are some structured, success mantras or, tricks and tips that one could follow that you have understood in your own lifetime and career of treating this particular disease?
So, Kabir, I can't stop myself from appreciating the kickstart you've given to the program. In fact, if we listen to each and every word you put, it actually has explained the entire program in one breath that you took to narrate the introduction to the program. So, see, at a workplace, we are spending most of our wakeful day. So it's like home outside home. Now that's one part of it. And Dr. Anjana and Dr. Hemant talked about the various aspects of diabetes and diabetes management. But let's understand that we call it a disease, and we treat diabetes to prevent the complications of diabetes. The word disease is broken up into two parts, dis and ease. That is, somebody who's told suddenly that you've got a complex metabolic disorder which will require you all your life to follow a certain diet, do exercise, have pills, do this, do that, is the dis-ease part of it. Now let's come to the workplace and take an example of two responses to somebody who's developed diabetes. And I'm picking up the words you used right at the beginning. So this person goes to his boss and says he's been diagnosed with diabetes. So we have one response which says, oh, damn, you've developed diabetes. Now you're going to live with diabetes all your life. You may develop complications of diabetes. It may affect your work performance. You have to go for regular checks. You will be spending more. A heart attack can happen. So most commonly diabetics, the quality and quantity of life may be afflicted by cardiovascular renal complications. That's kind of looking down. That's a pitiful way of expressing your concern for a person. It's not intended, but that aggravates the dis-ease part of the diabetes for that person working in an institution. The other word you used very well is empathy. The right way to deal with it at a workplace, and that's what we do when we deliver diabetes care, is to use the word empathy to give them strength. You tell them that yes, you have been diagnosed with diabetes. These are the reasons you've developed diabetes. Now life changes. You're going to be adopting a lifestyle which is going to give the power of your future health in your hands. It will give you an opportunity to make your life better, and through you, your family also going to benefit. That's what empathy is all about. You're showing.
It doesn't come easy, doctor. That's the entire thing. Empathy doesn't really come easy, and in this cutthroat world that we live in, constantly, game eat game, dog eat dog fight all the time. I don't know if we have enough room for empathy in these times. In the 21st century, with the advent of AI and all of that, everything that the machine is doing for us, who really has the time for all of this? I mean, so many diabetics out there. They, I think, push the entire problem under the rug because they've got so many other problems to deal with. Moving away from the sad picture of it all, the fact is that it can be fought, it can be managed, and it can be done in a very healthy way. But it's important, and I spoke about social media, so let's talk about that as well, Dr. Anjana. When we're talking about WhatsApp University, when we talk about social media forwards, what is that one myth online that you'd like to bust first and foremost?
insulin is your friend. It's not your enemy. It doesn't cause kidney disease. Not all diabetes can be reversed. Of course, that's the second one now. So not all diabetes can be reversed. And don't just believe anything you see. There's a lot of science that goes into medicine. So it's not just someone decides to say something on WhatsApp and says it, just don't believe it. Find out whether there's a shred of truth to it.
Yep. Again, a great point that you've put out, Doctor. I'm just not sure if everybody is capable of doing something like that, but let's help them in another way. What are some signs, Dr. Anjana, that first few symptoms that somebody, let's say I really manage my sugar levels really nicely, but the lack of insulin creation in the body can happen at any point in time. So what are some signs and symptoms that one can be on the lookout for, even if they think that they're not going to be diabetic anytime soon?
So the thing about diabetes is oftentimes the symptoms come rather late. 50% of people have no symptoms at all. And by the time you get the symptoms, you kind of miss the bus. So the symptoms you can get include, they are the classic symptoms, what you call drinking too much water, passing too much urine, being too hungry. So these are the 3 Ps, the polyuria, polydipsia, and polyphagia that we talk about medically. But those are kind of late symptoms. You could have very vague symptoms, feeling tired, not having, aches and pains, itchiness, wounds not healing, itchiness in the private parts, etc. So it really depends. And depends on the type of diabetes, it depends on the person, the age, circumstances, etc. But I would urge people not to wait for symptoms to come. In India, we have 101 million people with diabetes, and we have shown that the age of onset of diabetes in the age group of 25 to 34 years. So that's a shift to left by about 2 decades compared to any Caucasian population. And we are talking about an active workforce. So in this population, it's very unlikely that you're going to get symptomatology at that age. So it's better to look ahead of the symptoms. It's called screening. That will help you prevent. So looking at especially if you have family members, you probably do have family members with diabetes, you are probably overweight or obese, things like that. It's better to screen early on because the symptoms are rather late.
What exactly screening means, Dr. Anjana? Is it a particular kind of test? Is the glucometer enough, or is there some other test that needs to be done?
So the standard test is called a glucose tolerance test, or a GTT. For someone without diabetes, you give them glucose and then you check sugar a couple of times a day. But that's in the clinic. We do have the non-invasive test. It's called the Indian Diabetes Risk Score, or IDRS. So it's 3 simple questions and a waist measurement. So based on that, you get a risk indicator. Are you high risk, moderate risk, low risk, etc. If you're low risk, don't worry about it. If you're moderate risk, it's probably good to go to a clinic and get checked with a doctor.
How about you ask me those 3 questions? Let's see. Let's do this right here. I'm sorry, I don't have a consultation fee right now, Dr. Anjana, but let's do this right here.
I have to think about that. Yeah. Okay. So this depends on your age, how old you are, right?
Okay. Let's do this hypothetically. I'm 30 years old.
Okay. And do you have a family history parent with diabetes?
Yes.
Okay. And how physically demanding is your work?
My work wouldn't be physically demanding, but I do hit the gym at least once a day.
Okay. So I would say you are in the low risk category at the moment, young individual who's active with a moderate risk. And of course, you would need a waist measurement. I'm not sure if you're going to disclose that on television, but from the looks of you, it does look like that you probably would be a low risk individual, which means for you, maybe in every 3 years, you should get this redone to see whether things are changing and then at risk. But I would like to say, Kabir, that you are possibly an exception. We don't have 90% of the population does no physical activity, doesn't hit the gym. Yep. Definitely not once a day. A lot of them are going to have parents with diabetes, and a lot of them are going to be in the obese category. So which puts them at moderate or high risk and would need to see a doctor rule out diabetes.
All right.
The other thing, while this is for diabetes, hypertension, obesity, they're all like cousins. You find one, you're going to find the others. So,
Nicely put.
and what we find now is that even in teenage, you have people who are obese, their cholesterol is going up, blood pressure is going up. So screening, and all these are non-invasive tests. So doing these risk calculators, screening, using a blood test, being aware, first of all, and programs like these, I think, are hugely important.
Many thanks for that, Doctor. And I personally feel, and you're right, I see sometimes, teenagers in their 12s and 13s, racking up the weight and not really doing any work and getting all the love and pamper that they could from their parents, which is absolutely wrong. Because Dr. Hemant, I personally feel a lot of it happens in the kitchen. And the quintessential way, the Indian way of eating, we've come a long way from that. Our traditional setup was never meant for something like that. Even the Prime Minister on the Independence Day from the ramparts of the Red Fort said, please use less oil. Obesity is that big a problem right now. So I'm sure, because you're all top endocrinologists, you understand the name of the game. Your kitchens would be functioning much better than quote-unquote Michelin star restaurant somewhere, which is adding all kinds of calories in your food just to make that small little entree look really great and gourmet-esque. So when it comes to the kitchen, Dr. Hemant, what really does need to change? I come from a point of view that if you're quote-unquote fat and unhealthy and you're under 20, that's unpatriotic, isn't it? But that's a different thing altogether. The kitchen, let's come back to that. Dr. Hemant.
So I don't think we are discussing obesity just now as we are discussing sugars.
Yep.
What we need to remember is what Anjana correctly said. You have to curtail your carbs. And this myth that every festival and every good news should be celebrated with sweet. I'm not changing the myth, but the sweet can be a fruity sweet. It can be a low sugar sweet. There is enough evidence in society that even the common man has access to diabetic jams, to diabetic mithai, and things like that. So in the kitchen, instead of making your mother an pariah and say, this is not for you, you include her in the game, and you can give her diabetic Shrikhand while you're eating the regular Shrikhand. It tastes the same if you close your eyes. So you have to watch out for the carbs. The potatoes are empty calories. The rice, if it is red, it is better. Quinoa is better. Bajri millets are better. But if you can't afford those, because, as Anjana rightly said, you have a questionnaire. People don't have time to answer those 3-4 questions and get their waist measurements.
Yep.
Once a year, if you're putting on weight and if you're smacking of all the high-risk problems, get your blood tested. It's simpler because it's faster. Nobody's going to sit and say, okay, my mother has. No, maybe my mother doesn't have, but my aunt has. We believe when you're servicing a huge population, punch in and do a draw. Tell them, I don't like to send them to a dietitian who says, itna doodh and utna ghee. Use your common sense. Cut the carbs in any way you like. Fruity desserts. Don't have sweet potato. Have more of green leafy vegetables, lot of proteins. And it's not that fats are bad, it's the saturated and high trans fats that are bad. So you need a balanced diet. And that's not only for the diabetic, it's for everybody. Everybody wants to live long because if diabetes doesn't get you, hypertension gets you. And ischemic heart disease or coronary artery disease is also 1 decade earlier in the Indian. Indians who have gone out of India get earlier heart attacks. So you can take an Indian out of India, but you can't take India out of the Indian.
Yep.
So the kitchen of India travels with him. He has to see and enforce the discipline.
Very nicely put, yet again. Dr. Jasjeet, just a couple of minutes back, Dr. Anjana was telling us that the onset is anywhere between 25 to 34 in the young Indian. And, for the longest time, the bus has gone, you've missed the bus, and then you get to know that you might be diabetic. But on the other end of the spectrum, doctor, what are some warning signs that one should, never overlook, certainly?
So, see, I would first of all like to add something to what Dr. Hemant was
Please,
talking
please,
about
please do go ahead.
nutrition. I'll just make a 10-second diet plan for everybody who's tuned in.
Oh,
That 10
that's amazing.
second, yes, works on the universe of nutrition, works on three words, and there's a fourth dimension. The three words are quantity, quality, and timing. You can wrap up everything we've been discussing in these three words and balance out. And the two most important things are calories and carbohydrates. The fourth dimension of nutrition is why we eat things that we eat. Why do we love a rasgulla and why we, less like Karela? Just an example, a passing thought. That's a different session we can dedicate to. So
Absolutely.
coming back to, so that's how a nutrition plan should be perceived. And Dr. Hemant very rightly said these are very simple things. If we just follow our grandparents and the elderly people in the house, you get the best perfect diet plan to follow. The coming back to your question is about warning sign. Dr. Anjana very rightly said a large percentage of people with diabetes are asymptomatic. So screening and finding high risk population and doing the test is the right way. However, when we talk about people who've already developed diabetes, now can the symptoms guide to seek complications? Well, the answer is yes. But a lot of those complications may be asymptomatic. For example, we look at the eye. The
Yeah.
disease has to progress a lot before it leads to decrease in the vision. You talk about the heart, the arteries would be stenosed or blocked to a very large extent before they start developing chest pain or angina. Same is with the kidney. However, the nerves of the feet, when they get involved, the patients may complain of tingling, numbness, abnormal sensations, which are more so at the night. So that must warrant, oh, there is something happening. And the dictum in diabetes care and screening for complications is that if there is one complication, the risk of all the complications increase. So even the most subtle of symptoms, unexplained fatigue, weight loss, excessive thirst, means
Yep.
that your sugars are uncontrolled. The nerves, you have abnormal sensations, you get short of breath. Look at the heart, you get swelling on the feet. It could be the kidney be involved. Your vision is going down. The eyes may be afflicted. So these are the very basic things which should not be considered as casual symptoms. Each symptom, if the patient tells a doctor, has a
Yep.
meaning. It's affecting them. Pay heed and follow them up.
All right. To all the doctors on the panel, we've got some, audience questions. Many of them have already been answered. Roshan has asked, Doctor, what are the biggest daily challenges people face? We started with that. Pankaj has asked, many people fear insulin or strict diets after diagnosis. How can they overcome that fear? I think we haven't picked that up. So any of the doctors, whoever wants to take this particular question up, people fearing insulin or strict diets after diagnosis, and how do they overcome that particular fear?
Insulin is not a punishment. Insulin is a remedy. When you
Yep.
went to the eye doctor and he gave you a pair of glasses, did you feel punished? And the strict diet was also not a strict diet where he was anti sugar. He just asked you to rationalize it. And who says that every diabetic must get insulin? There are so many oral anti hypoglycemic agents. There are so many other injectable non insulin agents. So these are therapies. I don't think social media or Dr. WhatsApp should cloud it up and scare people with the carrot and stick approach, where the needle of the insulin looks like a devil and the carrot looks like the forbidden fruit. That's all I would say.
Yeah.
So can
But
I just
you
jump
see,
in?
Dr. WhatsApp has so much of accessibility. There's another question, Dr. Jasjeet. Yash has asked, how much does stress really affect the blood sugar levels?
Oh, that's, I was waiting for that question to bounce up. So, see, we have conventional risk factors, we have nutrition, we have physical inactivity, all these things are measurable. But stress has a very large role to play in causation of the disease and in management of the disease too. There is no methodology where you can measure the amount of stress. There is no stressometer. There's a blood pressure apparatus, there's a glucometer. You can measure them with precision, but there is no measure of stress. Oh, I'm having so much of stress. But it does impact all health parameters, any and every parameters. So the ideal part of a treatment for all non-communicable diseases is centered around nutrition, fitness, drugs, regular follow-up, have good sleep hygiene, and try to limit the stress levels. You may call it meditation, yoga, introspection, taking help from a psychologist. There's nothing wrong in any one of them. That's the holistic treatment of not just diabetes, all non-communicable diseases.
You know, Dr. Anjana, we're coming to the, towards the end of this riveting discussion. It would be real injustice if I didn't speak about Tandav. We do need to throw some light on that. What inspired you to create this dance-based exercise? I do understand in India, dance is more than just a cultural art. It's a celebration of life. We love to do it. Yet, there are studies now that say sitting is the new smoking. So, what inspired you to create this dance-based exercise like Tandav, and specifically for young girls in India?
So, I've been working with physical activity. As Sir just mentioned, diet and physical activity are like the cornerstones of treatment of any chronic disease. So, with trying to make people more active and doing it for more than 10, 15 years, I failed quite miserably because outside of a traditional program, people were not ready to be active. They do it for a period of time. If you push them, yes. And even in a program, there were huge differences between men and women. So people would come together, men would be happy doing the program, and then the woman would have problems. She's either shy, or her father doesn't like it, or her husband doesn't like it, or her grandfather doesn't like it, doesn't matter. But, there are some social barriers to a woman actually exercising. Moreover, see, children are okay as long as they're prepubertal. At puberty, the problems start, and not just physiologically, but socially. Girls can't go out, they can't go to the playground, they can't mix with boys, they can't do any kind of activity, and so this gets curbed. This woman then gets, married, she gets pregnant, she has a couple of kids, and she has all of chronic disease by the end, or even through this journey. So the importance of physical activity on its own cannot be overstated. I mean, it's so important for everybody, especially for a woman. So looking at innovative ways of making a woman active, that's where dance came in. And dance is something that is traditionally accepted in our culture for any age group, especially for women. So trying to incorporate principles of exercise, I do not know if you've heard of HIIT, it's high intensity interval training. So incorporating HIIT into dance is what Tandav is all about. So it reduces the time required. 60 minutes per day is a large ask for a woman in India. It's a huge barrier. So Tandav, it makes you do high intensity activity for a short period of time. So it's only 10 minutes. Needs to be done a couple of times a week. It has the latest Bollywood, Mollywood, Tollywood songs that, the young crowd generally vibes to. In a 10-minute routine, you have 4 such songs. So there's 2 minutes high-intensity activity where you have 80 to 90% of heart rate for age. Then you have a 30-second low, which brings down your heart rate to 50 to 60% for age. You do this 4 times with 4 different songs, and by the end of it, you've got all the exercise that you need. So this was an idea, a concept. At beginning, I myself tried it out with colleagues here at MDRF, and after that we went on to test it. We went to the St. John's Physiology Lab. We actually wanted to start with women, Kabir, but unfortunately we had very few women who meet the fitness levels who could do HIIT. So finally we ended up with girls. Even that was hard. We trained them. We then had to do proof
What's the response like now? What's the response like now? Are more and more people joining it?
It's thousands of women now and girls.
Wow.
We have girls and their moms together. We have published, we went to schools, we've done it in school, massive programs. So I must say the uptake has been fantastic.
All right. Well, I'm really glad about that, and I wish you best of luck. Tandav, it just sounds like Hrithik Roshan probably doing some of those steps. So anything that guy does is, in any case, HIIT in itself. Dr. Jasjeet, we're talking about fitness and physical activity, but there are so many people that look fit that would not have, an overstretched waistline, but they still get diabetes even if they're not overweight. What's happening in that particular complication?
So the answer to that comes from genetics, and it's a very peculiar phenotype that Asian Indians have. So you take a Caucasian and an Asian Indian who have the same weight, the same BMI. The Indian on an average would house larger amount of total body fat. That's one part. But the more pathological part of this fat distribution is centering of the fat around the abdomen. So the next 100 men you see, you would notice that most of the fat is centered around the belly, which is what we call as the abdominal fat or the visceral fat. And that is one of the most important pathological reasons why non-communicable diseases, including diabetes, is more prevalent. So there's this genetic and ethnic predisposition. On top of that, the environmental insults just makes it happen much earlier. And there's one factor which we rarely talk about is what we call as epigenetics. It's the effect of the environment in inducing new onset heritable genetic changes which may manifest the disease at this young age. So imagine a young person in the 20s who has no family history of diabetes, has a phenotype like you described, suddenly develops diabetes. So we have to look for reasons. So we say stress, we say you're working too hard, you're taking too many things on you, but we usually discount what is changing in the environment. Every day we hear about environmental pollution, PM 2.5, this, that, cloud seeding. That is a very important role to play and may be contributing to the younger onset of diabetes and all other non-communicable diseases in our population.
Dr. Hemant, you earlier said that when an optician gives you a spectacle, you don't look at it as punishment, don't you? I mean, in my case, it was my father's choice of the frame that, sound like more of a punishment for me. But if we were to go back to that particular fact and talk about one feel-good habit that every diabetic should start from today, that doesn't sound like a punishment. Let's end that show on that particular note. Dr. Hemant.
All I would say is get off 2 bus stops before your house and walk those 2 bus stops home. You'll feel fresher, you'll burn calories, you'll look leaner, your sugar will also get burnt, so your wife can reward you with a low sugar sweet when you go home. You've killed 5 birds with that one walk. Your heart, your muscle, your sugar, your BP, and that barfi which she gives you.
Well, from awareness to action, this World Diabetes Day, with the super docs on the panel, let's pledge to take charge of our health. Before we end this, Dr. Anjana, the India Works Diabetes Prevention Program and scaling that particular front, what inspired you again to bring a diabetes prevention program into Indian workplaces? How big is that setup? Quickly throw some light on that before we end this discussion.
Sure. So it's a huge program because we do have a lot of people in the working ages having all of these chronic disease, and hence the India Works was about making healthy workplaces. What are the components of these? So it starts with the canteen. Offering healthy food choices for employees was one very important thing we did. We also offered physical activity at their doorstep. So things that would make them physically active, weekly programs, whether exercise sessions, etc. And a whole lot of education around breaking sedentary behavior. You spoke about that a little earlier. So things that you can do in the workspace, simple things, you can sit on your chair and do some stuff, etc. So things like that were done. And we found overall, there was a huge improvement. There was reduction in blood pressure. There was a reduction in weight. people make healthier choices, and of course, there was some of them even reversed their diabetes. So scaling up this has been made into that was done in a program mode. It was funded by NIH at the time. Now this is now available for work sites to scale up as a program that they can choose for their employees.
Well, very nice. On that note, I think we've done enough to understand our bodies and support those around us. Empathy being one of those key operative portions that all the doctors told us about. Because when it comes to diabetes, knowledge is power and empathy seems to be the medicine. Once again, many thanks to all the doctors that have joined us, to all the people that joined us on the webinar. Many thanks for your questions. Many thanks to the super docs for taking out the time. Dr. Hemant, Dr. Anjana and Dr. Jasjeet, many thanks for taking out the time and speaking to us here on TV9 in this TV9 special in collaboration with USV, your reliable healthcare partner. Let's beat diabetes and win life together. Many thanks for taking out the time. We're going to continue to do these kind of webinars time and again. See you next time.